All right, it is about 6 o'clock. It is actually 6 o'clock on the dot, so we will get started. Welcome everyone to the 2025 Thrive series. We're really excited to have you here. My name is Liz Danley. I'm the Survivorship Events Coordinator at the Masonic Cancer Center. And today I'm co-hosting with my colleague Kaya Verich. She's a nurse clinician at the cancer in the Cancer Survivorship Program at M Health Fairview. And on behalf of the Thrive Planning team, we're really excited to welcome you to the series. If you've attended before, welcome back. And if this is your first time, we welcome you to the series. Thrive is a collaboration between M Health Fairview and the Masonic Cancer Center at the University of Minnesota. This year, we are proud to offer 5 sessions, 4 virtual webinars each Tuesday in October, and 1 in-person event at the end of this month. You're welcome to attend any or all sessions, and recordings of our weekly virtual ones will be available on our website by the end of the week. Before we begin, just a few notes. Please stay muted during the presentation and use the chat box for any comments and questions. At the end, we will open it up for a live Q&A. And if you'd like, you can either use the chat box or you can unmute yourself at that time for questions. If you are a University of Minnesota employee or spouse participating in the Employee Wellbeing Program, we will share a link in the chat to record your attendance and earn your wellbeing points. So now let's kick off our first session of the 2025 Thrive series. Tonight, we're excited to welcome Dr. William Robner. Dr. Robner is the Director of Health Psychology at M Health Fairview and professor in the departments of medicine and pediatrics at the medical school. Welcome, Dr. Robner.
Hi, well, welcome. I'm pleased to be here. Thanks for inviting me, and I'm looking forward to our discussion. So I'm going to share some slides here. Okay, can people see that? Yes, excellent. Okay, so this is me, and why don't we jump right into it then? Let me see where I have to move something on my computer so I can do that. Okay, so disclosure information, I work at the U, like Liz said, I have no financial relationships and will not be talking about investigational drugs. So where does this all get going? I think many of the people here have had this experience where they thought that they were doing fine and then they woke up and they needed a prescription of some sort or another. And it just happens. We get sick. We're human, and it's stressful. And Lily Tomlin, if any of you remember her, used to say the chief cause of stress is reality. And there's a lot of realities that people who are dealing with cancer are dealing with that add to that stress. So, what percentage of U.S. adults experience cancer at some point? A lot. About 40, close to 40% of men and women experience cancer at some point. The incidence has dropped over time a bit as we've learned how to lead healthier lives. And the good news is that mortality has dropped. So there is good news. People are not alone. There are a lot of people dealing with cancer at some point in their lives. And so I had this question a few weeks ago. Is living with cancer like having a full-time job? So I don't have a way of polling you guys. Um, some of you might say yes, some of you might say no. And then I realized that most people's full-time jobs are 40 hours a week, whereas there are what, 168 hours a week? So it's a little bit more like 4+ full-time jobs, because you never know when it's going to come up and what you're going to have to do to take good care of yourself. So let's talk a little bit about what it means to have an illness. There's a lot that suddenly having this illness causes us to do. We may have to live with pain or discomfort, incapacitation. We have to learn a whole bunch of terminology. I learn a lot from patients who are educating me about things that they've had to learn. We have to synthesize and understand it and try to make decisions based on it. We also have to deal with a medical environment. It could be clinics, it could be infusion centers, it could be the hospital. But we go from when we cross the line from being healthy to have some significant health issue, we have a lot to learn. We have to learn with all of the different treatments. What do we want to do? What can we learn about them? What are they going to do to us? And we have to finesse our relationships with the people that we meet along the way. It's a good idea to have good relationships with the nurses and docs that you're dealing with and the other healthcare professionals. There's another part of this, and that is dealing with other people's ideas about what you should be doing. People have ideas about, well, you should take care of yourself. If you have an illness, you should get treatment for it. They may have beliefs about why you are ill. Maybe it's something that you did. Maybe it's something that is a value of yours. Maybe it's some way that you're different from them. Maybe you're being punished for something that you did. They may have ideas that you're lucky you have your illness and not this other thing. Or they may have ideas of you should see this doctor or get your care in this hospital. If only you'd eaten an apple a day, maybe you would be keeping the doctor away. Who knows what? But people might say silly things or things that really might turn you off where they don't really understand what your experience is. They're trying to, some are trying to, or they may be afraid of what it means to be ill. You know, back in the 1950s, when we didn't really understand much about cancer, people would be afraid to visit people with cancer in the hospital that it might be contagious. So there's a lot of confusion out there. There's a lot that people don't really understand, or they're not equipped to dealing with it. Sociologists have weighed in on this as well. People who are in a sick role have certain expectations. They may be exempt from social responsibilities, like when I injured my back 15 years ago, and suddenly I was not the family lawnmower. I was exempt. They expect people that may not be able to take care of themselves, whether they can or can't. They may be incapable in some ways. They may need some help, which can be a very awkward feeling for people. People should wish to get well because health is necessary. Well, there's a lot. I speak to people all the time who can't do some of the things that they'd really like to do, and may feel like giving up at times because it can be so hard. They should seek medical advice and cooperate with medical experts. They should take all their medicine as prescribed. They should make every appointment that's made. They should be doing all these things, and it's a lot to be sick. What are some of the major tasks that we have when we have an illness for adapting? Well, we want to maintain some kind of emotional equilibrium. We want to preserve our view of ourselves, even if we may have some dents or bumps or scars or whatever that may challenge how we wanted to see ourselves. People have to figure out, how do I maintain my relationships with family and friends if I'm feeling like I can't do as much? People are dealing with an uncertain future. What's their course going to be like? Is it predictable? Will they get as healthy as they want to as soon as they would like to? Might they not get healthy again? So we can learn a little bit from Buddha. Buddha talked about the secret of health for both mind and body isn't to mourn the past that we had when, for example, when we weren't sick, not to worry too much about the future, to just spook ourselves, but to really live in the present as wisely and as earnestly as we can, to make each day be a day that we are fully engaged in living our life as fully as we can. The Buddha has wiser things to say than I do. When we're thinking about coping with any chronic illness, cancer or others, it's really amounts to experiencing a lot of losses. It's an ongoing stressor. Um, it may be with our comfort if we're having pain, or our physical activity, our independence, loss of some relationships. We may not see people as much as we used to because we're not going to work, for example, for some people. There can be hits to our finances, to being able to work, to our income, to having a sense of well-being, who we are. I used to feel like I was this person. Now I don't, I'm kind of a little lost. I don't know who I am because I can't do some of the things I used to do, or I can't be as spontaneous as I would like to be. where somebody says, hey, want to go somewhere, now I've got to think twice about how to work that in. So what is cancer survivorship? There are a couple of different definitions about it. Someone who's considered to be a cancer survivor from the time of diagnosis for the rest of their life. Uh, Another definition is a person with cancer after finishing treatment. And it's a process of living with through cancer treatment and beyond cancer. So I know somebody who doesn't like the terminology cancer survivor. There are a lot of terminology that people might encounter along this road that they may not like. Why is cancer survivorship important? Why is the care important? First of all, the number of cancer survivors through the course of my life has increased dramatically. There are a lot of people living with cancer. They may have had cancer in the past. Some people actually get so far past it they almost forget what it was like to have cancer. For some, it's relatively easy to return to their normal life after completing treatment. For some, they have more ongoing symptoms or effects. It may be that one of the treatments, the chemo or radiation or the surgery or biologics affected them in some ongoing ways, or they have to keep coming back for infusions or something like this. There are many different ways that it might affect people. One of the terms I didn't like when I first heard it, but I've come to embrace it, is the new normal. For those of you who have recently gotten a diagnosis of cancer or recently started going through treatment, life can feel different. And we have to make adjustments in leading our lives, finding joy, purpose, meaning, connection, etc., even though some things might be different. And again, that means dealing with things emotionally, the emotional challenges, the social challenges, the physical challenges. And people might have different emotions at different times. It might start out, there's a literature that the first 100 days might be the worst for somebody who's dealing with with a diagnosis of cancer. Because that's when, if it can feel like the rug is being pulled out from beneath them, and they're kind of trying to figure out, now what does this mean? How am I going to get through this? What is this going to entail? And you can see these are this may be dating me in terms of I assume you might recognize a lot of these people. Um, people can learn to live with chronic diseases, with ongoing diseases. They can lead rich, stimulating, meaningful lives. They can be in all walks of life. They can be doctors, lawyers, and Indian chiefs, etc. They can be the most important people within their family in terms of some of the roles that they have. People can be content with their lives even if they are sick or overcoming an illness. They can have high quality relationships with the people who mean a lot to them. And they can be productive even if they have some limitations. So that's part of living with various kinds of chronic illnesses, including cancer. What are some of the concerns that people with cancer often have? Again, the new experiences we talked about, new places and people that they may meet. People may have to learn how to be less inhibited or less modest. Like women, I knew one person with breast cancer who used to come in and tell me, well, we're up to 54 health professionals who've seen me without my shirt on. And I've always used to be modest. Nobody saw what my body looked like for decades before this. Um, People learn to deal with the uncertainties about the diagnosis, waiting for the path reports. What's the care going to be like? What side effects will they have and won't they have? Fear of recurrence or death, employment issues like we mentioned before, and finances, and increasingly things like health and life insurance. What does this mean for those things that I thought I understood? How much is it going to cover? What am I going to be expected? Will I experience problems with medical debts and so forth? There are growth opportunities with illness, cancer, and others, where people decide, well, what's really important to me? They develop perspective about what's the most important. I've known people where they were climbing the corporate ladder and decided, there are other things in life to do that I think are equally important or more important. They can feel good about accomplishing treatment, like when they might leave a cancer center ringing a bell because they've just finished their last chemo. They can appreciate their relationships. You can meet a lot of interesting people along the way, some very fine people along the way. I'm particularly fond of oncology nurses, for example. Um, they can have more determination about their future. Oh, I was kind of not sure what I wanted to do. Now I know what I want to do in my life. This has given me a clearer sense of purpose. They may understand more about themselves as well. Um, and they may find meaning in their suffering. What am I learning from doing this? How is this enriching me in a strange way? Not a way I would have chosen, but that I've grown to understand more. Um, from a mental health perspective, depression and anxiety can be common comorbidities, psychological effects. There's one statistic out there that I came across that people can be scared and can be traumatized by parts of their treatment based on parts of it. I've met other people where they say, my cancer was a big nothing. It was in and out, and that was it. So it's not the same thing to all people. So what is anxiety? That's a natural part of our ability to respond to stressors. It's a signal that something's happening. So some people liken it to the lights that go on your dashboard, like if you need oil or you need to get something's in the motor or in the tires. It's a signal to you that you're experiencing stress. And for cancer, again, it can be the sense of loss of control, or what's this chronic condition going to be like. These are the common symptoms of anxiety. So if you're experiencing them or know somebody is, uh, uh, it may mean that we have to bolster our efforts at coping. We may have to do some scaffolding, helping people to get some help from their friends, their family, their clergy, their healthcare team, possibly a mental health professional. Um, it these are things that people can benefit by medication from sometimes, or learning various strategies to learn to relax. Use some of the apps that are out there, for example. Um, People vary in terms of how much they worry. Where are you in this continuum? There's some on the left that what me worry from mad, or people putting their heads in the sand that this doesn't matter, or people like Bobby McFerrin, the musician, who would say, don't worry, be happy. And then there are other people on the other side who worry about everything maximally. My encouragement is to find ways of not being on the right, not fully being on the left, but somewhere in the center where you can make good choices and you're managing the emotional parts of this as well as you can. Let's talk for a moment about depression, which has been called the common cold of mental health problems. Many Americans experience depression at any point in time. People, especially who are younger or elderly, as well as people with chronic illnesses or acute illnesses. The lifetime risk is a bit higher in women than in men. The age of diagnosis has certainly dropped during the time of my career. And so we were increasingly recognizing this in school children and teenagers and so forth. So no one has a monopoly on this. Depression can affect many people. And it affects really brilliant people and really people who serve multiple important roles in society. Abraham Lincoln is somebody, for example, who wrote this quote. When I first came across it, it really caused my head to spin a lot. And he said in one of his letters to his law partner, I am now the most miserable man living. If what I feel were equally distributed to the whole human family, there would not be one cheerful face on the earth. Whether I shall ever be better, I cannot tell. I awfully forebode I shall not. Remain as I am is impossible. I must die or be better. So depression can really cause people to feel overwhelmed, to lose perspective, to feel great pain. And there is help out there, which is part of why I appreciate the opportunity to talk to people about this. And if people want to know if they're depressed, first of all, they may be getting some screeners and they go to some of the clinics that they go to. But these are the 9 symptoms of depression. For somebody to have meet criteria for depression over the past couple of weeks, they need to have one or two of the first two items of depressed mood, feeling sad, which we can understand. Or simply for other people, it's diminished interest or pleasure in things that from each day. And then they need to have a total of 5 of these. And you can see it can be changes in weight, appetite, sleep, how energetic people feel, loss of energy, feeling worthless or guilty, diminished ability to concentrate or make decisions, or recurring thoughts of death or suicide. So that's what depression is. And there's a lot of help out there from not just the oncology teams and people's primary care docs, but from mental health professionals, and from some of the groups that are out there that are providing support. What are some of the risk factors of depression? Medical illness is one of them, pain, a history of depression. You can read this list yourself. Um, Low social support, so it's important for people to seek out support. Um, uh, so uh, postpartum, if any of you are recently had children, postpartum depression is also something that we worry about. So there are lots of ways, unfortunately, to get there. And stress, again, like the stress of an illness is one of them. It's pretty common for people. So you can see the connection between depression and illness. They go hand in hand. Not everybody who gets depression gets a chronic illness. Not everybody with a chronic illness is depressed. It's hard to get an estimate about what percentage of people might experience it. It's just important to know that if you are experiencing depression, this is not unusual, it's common, and we can get you some help for that. And that's why places like the U hire people like me to see medically ill people. Depression can aggravate the effects of illness. When people are depressed, their experience of pain or fatigue might be worse. It disrupts their social life, and it can affect whether they're making it to their appointments, taking their medicines, and so forth. So we really want to make sure that people are getting good care of themselves. It can intensify some health risks. We think about people with depression may have lower immune function. It may affect how well, if they've gotten a graft, like from a transplant, things are, and may affect how their mortality. So it's very important. We may need to adjust medications and so forth if that's part of this as well, based on whether there are side effects or whether the drugs that they're taking might affect how well their body metabolizes their antidepressant medication. And you can see here in looking at various medical illnesses that there can be a range of estimates about the percentage of people who might have cancer, who might have depression. So for cancer, it's been a low of 5% to an estimate in the literature of 50%. Usually it's somewhere around a quarter. But you see this with other illnesses too: diabetes, epilepsy, strokes, multiple sclerosis. We see it in as well as in transplant people who have various illnesses. They get them to transplant. If we're looking within the cancer realm, you can see that different cancers may be associated with different levels of anxiety, which is the lighter color, or depressive symptoms, which is the darker color. And you can see that, again, roughly about 20% of people overall with cancers might experience some problems in the depression range or the anxiety range. The good news is, again, most medical patients have no diagnosable depression. Again, living with chronic illness doesn't mean you have to be depressed. Also, if you are depressed, getting treatment can be very effective in helping people to overcome it. Most people, about 3/4 of people who are depressed, still are able to function in society, to work, for example. And there's help out there if you need it. People develop concerns about employment if they have cancer. Will they have brain fog that makes it harder for them to focus? Will their fatigue make it hard to go in every day? Are people going to treat them in some discriminatory ways? They may also find great help in going to work. Like, just as you've seen probably football teams, if a kid on a football team develops a cancer, you see the whole football team shave their heads and show up to be there for them. You see that same kind of thing in work as well. I've known people where they had to be out of work for a period of time and they had various coworkers, uh, because they needed longer term help, various coworkers donate some of their annual vacation so that they strung together more days of work that they would be able to have a paycheck despite being out of work. The American with Disabilities Act is also important to know about if people aren't able to work. There are some protections that are pretty important and very helpful. People may have to look at their finances differently, especially if they can't go to work or they're out of work for a period of time. And so there are resources out there to help people. People can make also appeals. It's very useful to speak to the clinic's social workers and or county social workers to find out what kind of programs might be there to provide some scaffolding for them to be able to get by. You can also see some information like that from the American Cancer Society's website and so forth. So we're going to switch gears at this point and talk a little bit about being resilient, becoming resilient, although most of you probably are, and staying resilient, even so, though your resiliency might be stressed by the circumstances. So what is resilience? According to the American Psychological Association, it's the process of adapting well in the face of adversity, trauma, tragedy, threats, significant sources of stress, such as family and relationship problems, health problems, workplace and financial stressors. And it's the bouncing back from difficult experiences. I think that's the key part. We might feel knocked down for a while, but it's having resilience. It's getting our legs underneath us again, bouncing back to be able to contend and do the things that we want to do. So it's not necessarily a trait. Our sense of resilience might vary based on some of the circumstances. And we can also learn to become more resilient. We can work toward becoming more resilient by how we're thinking about our situation, by what we're doing in terms of our behaviors, reaching out for other people, so that we can feel a sense of wholeness and while we're going through a stressful time. Social support is really important within and outside of families. Some people say that their relationships with friends and key people in their life deepen when they are experiencing something like cancer. They didn't realize that they were as appreciated, and they didn't realize that people cared as much for them and were willing to help them. Years ago, we had a young man who went through 2 bone marrow transplants at the University of Minnesota. And his family had been very involved in their church. For a year, members of the congregation would bring over dinner to them every night. They didn't cook once in that year. And so part of this is asking people for help if they need it. Part of this is treating people around you well in general, so that if you do have some difficulties in life, people are going to want to reach out and help you. So, and when people are going through something like this, they're needing to create trust and affection with people around them. They need to see role models of people who are dealing with similar circumstances, which is why support groups can sometimes be helpful. Sometimes it's very informal support groups, like people who are going through infusions on the same schedule and are talking and learning what's working for them, where people are being offered encouragement and reassurance. There are different types of help that people need, and support and asking for it is a really good way of starting a process of trying to find it. We may have to fire some people who are not very good at doing that, or not look to them if they're not very good at that. There's some people in your life that we'd like them to act in a way that are really helpful and supportive, but they may not be very experienced about it. They may not know what to say. They may be afraid of dealing with somebody who's ill. They may have agendas like religious agendas or something else that make them maybe just be approaching it from a different perspective, that we may want to limit how much we look to them for and find it more from people who are more capable. Again, strong relationships really helps. When people are ill, people tend to do better if they can cultivate relationships and really um, um, experience them. Again, some people develop much closer relationships that they feel more authentic, that they can talk about things that are hard, because they're not sugarcoating it for everybody. They're not just saying, "Oh, I'm okay" every time. They're really hearing, being able to say, "This is what was hard for me today. Thank you for listening." Other factors in resilience, being able to change plans, to make some plans. How am I going to spend my time? What's realistic? To maintaining a positive self-view, even if someone feels altered somewhat in terms of their strengths and their abilities. I used to be a pretty fast bicycle rider. I'm going to tell you all now, I'm not that fast a bicycle rider. I had to find a way to be fine on a bicycle, even if I'm not the fastest person riding. A key is making sure you're cultivating your communication skills, being able to speak about difficult things, being able to speak kindly to people and not just fighting them, as you see so much polarization out there about so many things. Cultivating our problem-solving skills. Well, if I can't do this the first way I'd like to, or as quickly as I'd like, how do I learn to tolerate that? How do I learn to be creative and find some other ways of problem solving? And the ability to manage people's personal feelings is a key part of this. Again, looking for things that are positive each day, not just focusing on what's the most challenging, but being able to see past that, finding whatever it is that can tickle your funny bone or can help you to feel that you're having some good things happening today, even if there's some hard things happening today. We were talking about connections. Groups like churches, civic groups provide support groups, as does groups like the American Cancer Society, or there are specific types of cancer groups that can be helpful, support groups for, let's say, pancreatic cancer, or kidney cancer. If you look, you can find them. Some of them are virtual, some of them are in person. Some people like support groups, some people hate support groups. Know yourself, figure out whether it's the right one for you. If it is, great. If it isn't, you may want to check out whether some others might be. It can be helpful to vent. Not everybody is good at hearing venting. Not everybody wants to vent, then don't, but seek support in whatever ways that you want. Self-care, really very important. Whether it's through your pets that are being very kind to you and sitting on your lap, or coming over to be pet, getting enough sleep. A lot of these things, nurturing yourself in whatever ways, eating well, sleeping well, avoiding things that maybe aren't so good for your body, like alcohol and so forth. Some people find it really meaningful to journal. One of my colleagues, an internist, developed breast cancer a number of years ago and started to keep a journal. And after a while, she realized, oh, this is sort of interesting. She started to share the journal, and people said, you should write a book. And she ended up writing 2 books about her cancer journey, which was a very helpful way for her to cope with things. And part of it was she was looking for humor every day. What's funny about this situation? Let me open my mind to finding that some things can still be funny and can still be very much deep in helping me to appreciate things throughout the day. We have to learn that change happens. The more flexible we are, the more adaptive we are, the better we can do. So accepting things that we can't change is a big part of it. Developing realistic expectations for ourselves. This is what I can do. This is what I can't do. This is what people in my life can do or can't do. This is what my medical team can do. This is what they can't do. Learning to cope with challenges, taking things a day at a time, like people in Alcoholics Anonymous talk about. Again, focusing on the present, not just getting too bogged down in the past or the future, not getting ahead of our skis when we're thinking about, where's this cancer taking me? Let's take the ride and make sure that the ride itself is going as well as it can. You may have heard of the serenity prayer, seeking the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. I'm always surprised that people don't talk about this so much with health issues. They talk about it a lot with substance use issues, but I think it applies very much to the kind of health issues that cancer creates for people. Managing stress comes in multiple ways. Again, social activities in the journal, the support groups. For some people, it's counseling. For some people, it's trying all kinds of complementary treatments, yoga, acupuncture, mindfulness, learning how to meditate, seeing if that's something that's helpful, listening to music. Exercise can be a big part of it. For some people, it's getting out into nature. It might be walking their dog in a park. It might be something else. Finding things to laugh at. I've known people who've started to watch comedy shows much more often on Netflix when they become ill and they're going through a hard time. So there are things that are meaningful to them. Developing hobbies. If people play an instrument, playing that more often. Making time to do things that are enjoyable, that you can do. Some recommendations. Again, the healthy lifestyle, like we were talked about before. With cancer, those vaccinations are important. Keeping yourself out of the sun is important. Uh, Weight management can be very important as well, and getting good nutrition. Trying to maintain a healthy lifestyle. If your lifestyle included things like smoking or using substances that have a downside, maybe now's a good time to really stay away from that. Um, Practicing the sun safety habits, for example. In terms of physical activity, that's me over on the left pumping iron. Using both a combination of aerobic activities, cardio activities, as well as resistance to improve our cardiovascular system. Exercise can be helpful, not just in terms of that, but in terms of helping us with our balance, helping with fatigue, helping people to sleep well, helping people to discharge anxiety and tension. Um, Getting good exercise can be a very helpful thing for depression. If somebody shows up at a primary care doctor's office in Britain and says, "Doc, I'm feeling depressed," they will leave with an exercise prescription. If somebody shows up at a doctor's office in the US, they're more likely to end up with an antidepressant. So you want to use whatever modalities work for you, but the exercise can be a really important part of it. There's been some literature that shows greater survivability, longer longevity with various types of events between groups of people who are exercising and groups of people who are not. And that includes this childhood Hodgkin's lymphoma study of adult survivors. Nutrition, like we were talking about before, can be really helpful. So if you're deciding that paying more attention to your health is happening now, there are all these different ways to do this. Some of this is redundant from what I was talking about before. This is one of my favorite cartoons. One apple every 8 hours keeps 3 doctors away. It would be nice if that were the case. We don't guarantee the results on this one, but eating healthily can be a big part of this. All of the complementary treatments that I mentioned a few minutes ago, you can see a list of them here. If you haven't tried any of them, now might be a good time to see, can you work that into your self-care regimen. Spending time in peaceful places. It could be nature. For some people, it's churches. For some people, it's going to theaters. I knew one person who, as a family member, was dealing with cancer in their life. This was before 9/11. They got a key to their church, and they would say if they were having a hard time sleeping, they would just go to the sanctuary. The clergy person gave them the key. They would go in the middle of the night. That was a place that they always could feel okay. So finding places that feel okay to you. This one in the lower left-hand quadrant, that's a picture of the cancer survivors park in downtown Minneapolis, just a block north of the main library. If you've never been there, the idea is it's a place that you can go to just to kind of deal with your health challenges and get some encouraging messages. So I encourage people to check it out. It's a lovely place. So if you haven't heard of it before, now you have, and you may want to put that on your list of free destinations that you can go to and kind of explore what this journey is like for you. National Cancer Survivors Day. You may want to start celebrating it. Trying to cultivate a mindset of gratitude. What's going well on any given day? What can you appreciate? about it. Maybe it's that the traffic wasn't so bad coming into the university that day. For who and for what am I grateful each day? Are there some silver linings to enjoy today? And you want to be on a scavenger hunt of silver linings to try to extract as much positiveness in as you go through the day and in the world around you. So take home messages. This, I believe, is the last slide. We all will face health challenges and medical problems, medical challenges like having a cancer diagnosis will precipitate some psychological. So give yourself the task, address those in the best way that you can. Fortunately, there are lots of ways to cope effectively with illness. It's not just one way. I encourage you to find the ways that work best for you. And if you need help to bolster how well you're coping, then find it. Look for it. Ask your healthcare team for it. And so with that, I think we're going to end this show. I'm going to stop sharing the slides. So give me just a moment here. And if I can find how to stop sharing, I will.
It looks
Uh,
like you have,
have I
at
stopped
least
sharing?
on my end. Yes.
Okay, terrific. So I'd like to open this up for questions. I don't know if people would prefer to ask them themselves, or Liz, would you prefer that I look in the chat and see what's there?
We can help with the chat. I
Perfect.
we can do either. If you'd like to unmute yourself and ask a question, or if you'd like to type it into the chat, either way, I'll be here to watch the chat for you. Does anyone have any questions to start? We did have a couple questions come in just from the registration. One person had asked, is it the new normal that to fear cancer, excuse me, is it the new normal to fear that cancer can come back even after your scans show clear?
Yes, good, great question. That is the new normal. So if we were to graph out what people's anxiety looks like, people, after they've gotten a good read on a scan, they feel relieved. So their anxiety had been going up typically. The closer they got to the scan or to hearing the results, the higher the anxiety. Then they hear that there's some good news, it tends to drop out, and then it tends to increase months or annually later as they approach, when are we going to take a look again? So that is something that people learn to live with. And again, it's during those times that that anxiety level is increasing that I encourage people to increase what they're doing to try to cope effectively. How can you distract yourself from just wondering about what's going to happen, what's in this, and really, so that's a great time to be going to concerts or the plays or to be binge watching things or to be listening to more music or getting together more with friends or to be, paying more attention to eating well. So there are things that you can do that reduce your attention to it. And when those questions come up, you want to, I think, try to figure out, okay, what are some of the antidotes? So more of the things like meditation, more of the things like getting together with friends, just sharing with people, gee, I'm nervous about what's happening with this next scan, gets it off of your chest, and then that provides some relief as well. So yeah, that is the new normal. Most people who have cancer are going to be under surveillance for some period of time afterwards. And they might always wonder, well, what's this it's not just the scans, but it's also, what if I have a new ache or pain or mole or something? It's like once you've crossed the line of having a significant diagnosis, in this case, cancer that we're talking about today, one never goes back to the sort of almost naivete that we would have had earlier before then, where we could imagine our life going on forever and us never having sick. Once we've gotten sick, we have to figure out, how do I cope with that as well as I can? What can I do constructively to cope as well as I can? So that's a great question. Thank you for that.
Yeah. Um, Unless someone else has a question, wants to pop in, there was another one for the psychological aspects. How does one regain their sense of self and their confidence? Cancer has taken so much.
Well, I think in part, and you know, we push ourselves to do more. And so if we, you know, if we've been stuck in the hospital a long time, we're going to be feeling a loss of confidence. We're going to feel weaker because we are getting weaker by lying around instead of walking around. And so we have to give ourselves time to rebuild. Same like, athletes do after they've had an injury. They don't go from, having the injury or the surgery to going right back onto the front line of the football team. They have to rebuild. And so there's a rebuilding process, both physically and sort of emotionally. The more things one can do for oneself, the more one's sense of self-confidence grows, and the more things somebody's going to do. But it does take time. So, when we have an illness or recovering from it, if I knew how to distill patience and could sell it, boy, I think I might be kind of competing with Elon Musk, because that's really financially, because that's really one of the things that people need in spades. Patience with the process, patience with getting from here to where they want to be. And not being upset with themselves, like, oh, I can't do this or so forth, but really having a lot of grace towards oneself about this. And sometimes people find it helpful to keep track, with all the devices that we have, our phones, keep track of our steps and so forth, but kind of graphing out to see how they're getting stronger by, if not the day, by the week typically, and when they're recovering, how many more steps can they go, and pushing themselves to keep doing more. So it's easy for me to say when people feel crummy, it's hard for them to maybe do. Um, but really working toward that, seeing that as part of the project of your recovery. Did you have another question?
Yeah, there's another one. So one person asked, how would one know when it's time to seek professional care? Or how does one go about finding someone? The system itself can seem overwhelming.
The system is overwhelming, so you're on your perspective is accurate. Um, there's no one way to do it. Sometimes you can look for yourself at lists of anxiety symptoms or depression symptoms, which are the two that, we were talking about the most, and see and keep track. And if you're feeling like, hey, there are more days than I wish I'm having these feelings, that might be a good clue. You might also ask other people in your life, how do they think that you're doing? How are you coming across? And in terms of seeking help, there's no one way of doing it. You can ask your primary care doc or your cancer team, do they have any suggestions about people that you might be able to see? There are websites. It's really hard to know who's going to feel like they're really experienced, because not all mental health providers have experience working with people who are medically ill. So, there are all kinds of ads out there and so forth. And unfortunately, I think it's gotten harder during the course of my career to have a sense about who would be a good person and how do I get there. And what's also gotten harder is more people are seeking care, which is in some ways a good thing, that people are recognizing that they need care and are seeking it. In a way, it's a bad thing because it's caused more delays in how soon people can often get care. If people are really worried about how they're doing, and really feel like they're hitting the skids, they can go to the psychiatric emergency room at Fairview on the West Bank. There's the Behavioral Emergency Center. If they're getting their care elsewhere, they can go to the acute psychiatric services at Hennepin County Medical Center. But in terms of if they think that they may want to try medication, they can speak to their primary care doc or the oncology team. And most prescriptions for antidepressants and anti-anxiety meds are actually prescribed by primary care providers. So it's not just mental health providers that they can see. They can get help in lots of ways. A lot of people will seek help through clergy or, you know, there are all kinds of community services out there that people might get help from. So it depends on what you're looking for. But I really encourage people to think about, might this be useful to me? You're, you know, it, the challenges might be new to you, but they're not the challenges that I showed to you at the very beginning. What are the challenges for adapting to illness? That was written about in the 1950s and in the 60s and 70s.
Mm.
So some of us have been thinking about this for a long time. And, it's not that scary to meet with a mental health professional. We don't bite, don't yell at our
Good.
patients, and we don't typically come at them, giving them injections and so forth that like your kids might have felt scared of when they first saw a pediatrician. We just talk to people.
I have one additional question, if that's possible. I wrote in the chat, I'm struggling with my oncologist timeline for my next scans. Her responses to me lately are impacting my trust in her. And I feel like trust in your oncologist is pretty important. And I realize I don't know what she knows,
Yeah.
but
Well,
I don't understand.
I,
I wish she would just say moving it up a week or two won't matter.
yeah, well, first of all, I think it can be helpful to speak to many docs about this because your care is a partnership between you and your docs. Now, we don't want to give people too much radiation, through scans, so
Sure.
we're creating more problems. So there is some balance. I have had many patients who've moved up a scan a week or two if there was some concern about it. Sometimes it's not possible if somebody's on a protocol, let's say a clinical trial, like it's already prescribed, this is how often this will.
Sure.
So there can be some extenuating circumstances, but I think that um, you do want to ask them more about that. And if you're feeling a lot of anxiety in that lead up, like if you said a week or two, then part of this might be what can you do to deal with your anxiety during that time to kind of take your mind off of it to help you
Sure.
successfully with it. So there are lots of ways to do, but I do think that it's important to be having that trust with your docs and being able to talk to them about that so that you understand and you can agree with, oh, now I see why it's this length of time for the interval. There are some people who would love to get a scan every day, and that would be terrible,
Oh
right?
my.
Things only grow at a certain speed and so forth. Um, and a lot of docs, if they know that this is hard, will try to compromise. And I can't say that's always possible, but they will,
Sure.
okay, well, let's figure out what might work here. If they're looking at metrics of something that's, for example, every 6 months, it may be harder to interpret, okay, if I moved it up to 4 months,
Ah,
now what do I know about how much it's
sure.
studies are for 6 months, for example?
Yeah, that's helpful.
They may have reasons for doing it that would make sense if you could understand it. And that's why I
Yeah.
think talking through with them and what else can we do to look at how I'm doing. And scans aren't the only ways of knowing how somebody's doing. There are blood tests, which there might be some similar constraints on. There's physical examination and other things. And also seeing how well you're doing in terms of your recovery, in terms of strength and activity and functioning and so forth. That might also give people some clues. Before we had all the wonderful scans that we have now, docs were treating cancers, right? And so there are lots of ways that docs can get a sense from you about, and then they can't see through your skin to know how you're doing, but
Sure.
they may have some sense about how you're doing. And they're curious too about how you're doing because that's
Sure.
how they're
I
going to.
guess I know you have no context really, but is there a reason for using a scan over uh like a blood marker test or a tumor marker test?
It's going to vary on the cancer, and you're right, it's not my area of expertise, so I'm not going to comment on it. But
Okay.
But I think what you're wondering about is where is this going and am I to getting the best care I can?
Yes.
That's a discussion with the doc about are, are we making good decisions together that you can feel comfortable with? At times, people might feel uncomfortable and then they might seek a second opinion.
Hmm.
What I've done. Is there another doc I want to meet, or another institution I might want to check out to see is their treatment plan the same as one doc's? And healthcare, medical care is a very human endeavor.
Sure.
Different docs have different ideas about how to do things, and they may be looking at different studies and so forth. So I would say don't be afraid to be a good advocate for yourself. There's a book by Elizabeth Cohen that I often recommend to people called The Empowered Patient.
Okay.
And, that can be helpful to learn about how can I really feel like I am maximizing what I know and what I can speak to in my healthcare. So, allow yourself to do that and have some curiosity about that and compare notes with other people about what they're doing. The different docs will take different approaches.
All right. Thank you. What's the author's name? Elizabeth.
Elizabeth Cohen, Cohen. She's been a healthcare correspondent for CNN in the past.
Okay.
I haven't seen her recently. But that's an example of a book that might be helpful so that you feel like you're not just, not having any say-so in terms of what kind of care that you're getting.
Yeah, I will order it because I struggle with the fine line between being assertive and sometimes being tempted to be almost aggressive.
Well, I would generally caution against the aggressive, but I would also
Oh,
equally
certainly.
being too passive and trying to find where's that line and what's some language I could use. Yes, with some people, I will encourage them to write down 3 things they want answered when they're going to the appointment so that they don't forget about it and they can have some sense on the agenda as well. So, as people go through this, they develop ways of interacting and hopefully it's mainly adaptive. But again, you're on the same team as the doc, so you don't want to be aggressive.
No,
You want to find some ways of getting your needs met or helping you to understand your situation as well as you reasonably can.
thank you.
Yeah, great questions. Thanks, Amy.
We've got about 3 more minutes, so there have been a couple people who have asked about this one. Can you comment on the watch and wait challenges in cancer?
Yeah, so cancer guidelines vary over time. They varied, for example, in how often women should get mammograms. They varied about men getting PSA and digital prostate exams. Docs are trying to figure out, do we intervene in some way that can create problems while helping with other problems? And so there are times that if somebody is not particularly symptomatic, the watching and waiting might work for them. In part, you have to know yourself. If you're someone who thinks I'm an intervener, I want this thing taken out or this thing treated, they may not be the best candidate for watching and waiting. What your doctors know is what's going wrong when things have not been treated early enough, or what's going wrong if treatment has come too early. And that's something that most people don't see. So they might have some ideas about this and some ability to tolerate that better. I think that this is also an example of something that you want to have a good conversation with the doc. What are the potential pros and cons of waiting and surveilling this? And what are the potential pros and cons of an aggressive treatment? I know people who hate chemotherapy. I know people who have a hard time with surgery, and people who feel really fatigued after radiation, or some of the other kinds of cancer treatments, or they have not had good side effect experiences with things like the biologics. So you know, we want there to be an absolute right answer. And in healthcare, we're sometimes balancing different things that are challenging. And that's why the watching and waiting and surveilling and doing it frequently enough, like Amy was asking about a moment ago, really warrants discussions so that you understand your doc's thinking. And most docs these days want to hear what you have to say. They don't want to tell you what to do. They want to hear from you what you're thinking of as you learn some things about what some of these options are. And I know somebody in my family right now who's wanting to take the watchful waiting. And, you know, I would prefer that they actually did something more aggressive, but it's their decision. Patients have autonomy, and docs know that too. And a lot of the decisions are going to be yours, but not all of them. But you know, being good at communicating and being able to tolerate uncertainty and being able to try to comprehend very complex things. And most of you, I'm presuming, have not gone to medical school, and this is like new to you, and making these kinds of decisions is not easy. So that's why more frequent appointments can be helpful, so that you're developing good partnerships with your team. Asking the nurses also, I've mentioned this mainly docs, but ask the nurses what they think too. They've been watching things as well.
Fantastic. Well, I just want to say we are all out of time today, but huge thank you to Dr. Robner for joining us this evening and for all of your insights. For everyone attending, you'll receive an email shortly with a quick survey to help us continuously improve our programs. And then we hope to see you next week, as we'll have Dr. Robert Tureski, who will be discussing diet and lifestyle factors in cancer risk. Thank you, Dr. Robner. We really appreciate it.
It's been a pleasure. I really love the opportunity to talk. Sorry it wasn't in person, but this was pretty good.
This is great. Thank you.